This is the artificial intelligence voice of Dr. Andrew Huberman narrating this pod-slice summary of the Huberman Lab podcast. In this podcast episode, Dr. Andrew Huberman hosts Dr. Karen Parker, director of the Social Neurosciences Research Program at Stanford University School of Medicine, specifically focusing on autism spectrum disorders. Dr. Parker's main research goal is to explore the biological basis of social functioning across all life stages. This includes childhood bonds, which provide the template for social functioning in adulthood. The critical emphasis of their discussion concerns autism, its alarming increase in incidence over the last decades, and the theories surrounding its biological basis. Current data estimate that 1 in 36 U.S. children have a diagnosis of autism. Autism is male-biased in prevalence, so studies have demonstrated that for every girl diagnosed with autism, there are around 3 to 4 affected boys. Autism is diagnosed through observed behaviors, typically by a psychiatrist or a psychologist. It is not something one could reference from a simple blood test. The main indicators are challenges in social interaction and the propensity for restricted, repetitive behavior. However, other symptoms can often accompany autism, such as anxiety, seizure disorders, sleep disorders, and sensory challenges. Each individual with autism presents a unique set of traits, hence the frequent saying, if you've met one kid with autism, you've met one kid with autism. Regarding early diagnosis, physicians may now reliably diagnose autism in 2-3-year-olds, reflecting increased awareness and diagnosis finesse. The earlier these diagnoses take place, interventions could commence. There is no consistent rule or timeline about when these interventions should begin. It really depends on each unique case. Dr. Parker also mentions the baby sibling studies, which follow infants that have older siblings diagnosed with autism and are therefore at higher risk of having autism. Interestingly, individuals in STEM fields have scored higher on autism quotient IQ, indicating they carry a greater burden of autistic traits, even if they haven't received an autism diagnosis. This fact sparks an intriguing question of autism being a multidimensional spectrum, not just classified by severity from mild to severe, but overlapping areas of different characteristics, indicating the complexity and individuality of autism spectrum disorders. The discussion now delves further into the impact of 2 ancient peptides, Oxytocin and Vasopressin, on social behavior. Both are small and structurally similar with just 2 differing amino acids. However, their similarities go well beyond their structures, as both play significant roles throughout hundreds of millions of years of evolution. They're conserved within various species, from humans to animals, and influence social behavior and reproduction. These peptides are, in essence, universal biological keys to social behavior, with their influence extending horizontally across species and vertically across evolution. At this point in the conversation, a particularly interesting element is the introduction of the critical questions surrounding the nature of autism, whether it's singular or it encompasses multiple conditions or disorders. This question arises from the observed complexities in autism patients, who often present with not just autism, but a host of other conditions. The spectrum of autism thus might be reflective of multiple concurrent conditions rather than one inclusive disorder. Dr. Parker postulates an analogy comparing the current state of autism with the history of cancer biology. Like autism today, cancer was once a generalized term treated with blanket approaches such as radiation and chemotherapy. Over time, advances in molecular tools led to personalized diagnoses and treatments targeted to attack specific types of tumors. Dr. Parker suggests that autism, currently identified and classified by behavioral criteria alone, presents a complexity that demands a similar approach. As increased knowledge and understanding revolutionized cancer treatment, gaining a comprehensive understanding of autism's biological basis, deciphering its complexities of genetic heterogeneity, and defining subgroups could revolutionize autism therapies and interventions. The importance of environment and its interaction with genetic factors is also stressed upon. External factors like parental age, prematurity, and maternal illness during pregnancy can raise the risk of autism and vary its presentation. Advanced, large-scale epidemiological studies have difficulty isolating precise influences due to the vast heterogeneity amongst individuals, thereby necessitating condition-specific genetically defined control groups. Such an approach could potentially reveal information about how different types of autism react to different environmental risk factors. This involves not only understanding the genetic variations amongst these diverse subgroups, but also in selecting the most appropriate animal models for research and intervention testing. This provides us with a critical understanding of why autism is present in some and absent in others, taking us a substantial leap towards personalizing autism diagnosis and treatment. Oxytocin and vasopressin are two ancient peptides, structurally similar, yet diverse in function. Discovered first for their peripheral effects. Oxytocin, uterine contractions, milk release, and maternal bonding, and vasopressin in urinary output regulation and blood pressure. They gradually garnered scientific interest due to their presence in the brain. This led to revolutionary research exploring their roles in behavior and social bonding. The conversation then ventured into the domain of mother-infant bonding. The birth process in particular was noted to trigger a crucial flurry of oxytocin affecting both mother and child. However, the nuances of bonding may vary considerably. Sheep and goats, for example, require immediate parental bonding since their offspring are precocial or capable of independent movement shortly after birth. For such species, the passage of the baby through the vaginal canal triggers oxytocin release and subsequent bonding behaviors. For humans and other primates, on the other hand, the mechanisms and triggers of bonding might be considerably more multifaceted. Their broader social structures, extended family groups, participation of multiple caregivers, and diverse rearing settings hint at a more complex network of evolutionary, genetic, and environmental factors influencing bonding. Dr. Parker's personal story ironically anchors the contrast between human and animal bonding. Despite a C-section and minimal lactation, her bond with her son remained incredibly strong. It's a placitations in autism research. As a hormone seemingly crucial to social interactions, the potential of oxytocin to enhance the sometimes impoverished social abilities in autism spectrum disorders is tantalizing. However, caution must be exercised. Autism's social features are diverse, with subtypes ranging from social avoidance to highly anxious social interactions. Misunderstanding and misphrasing can result in children being labeled as socially odd, when they may merely be struggling with navigating social cues. While brainstorming the possible roles of oxytocin in humans, the duo clarify a common misconception. Picturing oxytocin as the love hormone oversimplifies its diverse scopes. Instead, it's better described as a hormone primed for channeling bonding behaviors, as seen in mother-infant relationships or even romantic partner interactions. Even here, though, efficacy is task-dependent. Externally administered oxytocin merely impacts the amygdala's response to fearful stimuli, making people more open, trusting, or pro-social. However, understanding exact oxytocin roles in humans can be challenging due to complexities surrounding its administration, absorption, and imaging. Disentangling these challenges could unlock a fuller understanding of oxytocin in humans, potentially illuminating more tailored therapeutic strategies for behavioral and social disorders such as autism. The story of one such challenge is highlighted in autism research, displaying this tangled intersection of biology, behavior, and the human social world. In this section of the transcript, the focus is on the use of oxytocin as potential treatment for autism. The podcast discussion reveals that first studies on oxytocin's effects on autism were done on males, mainly due to the idea that the peripheral effects of oxytocin on, for instance, milk let down or uterine contractions, would not occur in males and it might be safer. Furthermore, autism is more prevalent in males. Initial studies involved in transalp administration of single doses of oxytocin. Some assessments included whether it allowed individuals with autism to ascertain emotions from photographs of eyes or how their eye gaze was influenced by social cues. Early results demonstrated potential effectiveness, inciting great interest in the possibility of using oxytocin as a therapy for autism. Given the complex nature of oxytocin's impact, identifying the exact roles of oxytocin presents significant challenges, especially considering the difficulties related to its administration, absorption, and imaging. A particularly poignant example cited is the application of oxytocin in the treatment of autism. Autistic patients demonstrate diverse social behavior ranging from avoidance to high levels of anxious interactions, and misunderstanding these behaviors can lead to indiscriminate labeling of them as socially odd. Humorously, the term love hormone is often associated with oxytocin, yet this grossly oversimplifies its complex nature. Rather, according to Dr. Karen Parker, oxytocin serves more as a social hormone, being primed to facilitate bonding behaviors, such as those seen in mother-infant relationships or even romantic partnerships. Interestingly, the efficacy of oxytocin is task-dependent. Externally delivered oxytocin affects the amygdala's response to fear-triggering cues, making individuals more susceptible to being open, trusting, and pro-social. There is, however, much controversy in the field regarding whether oxytocin could be an effective treatment for autism. Numerous detailed studies have been conducted, including an extended multi-site phase 3 oxytocin treatment trial that yielded no benefits. However, a small study by Dr. Parker's group at Stanford revealed a potential subgroup of individuals with lower pretreatment blood oxytocin levels who showed better responses to oxytocin treatment. Worryingly, negative trials stifle interest and subsequently funding for further research on the potential benefits of oxytocin treatment for autism. Concerns regarding the potential risks of oxytocin administration pose additional obstacles to the advocacy of this treatment approach. Despite these difficulties, the conversation underscores the importance of relentless pursuit and ingenuity in scientific research. By investigating different methods of delivery, assessing multifactorial impacts, and identifying subgroup responses to oxytocin, researchers may yet unravel the intricate puzzle of oxytocin and its potential applications in autism treatment and beyond. The conversation continues to focus on the potential therapeutic effects of oxytocin, as well as other agents in the treatment of autism. Strategies adopted include the modification of social cognition and behavior, thereby rewiring brain circuits to tap into the potentiality of neuroplasticity. The use of SSRIs, which can induce neuroplasticity, has been considered, though its effectiveness can vary and possibilities of side effects exist. Additionally, the exploration of substances such as psilocybin and MDMA, which are known to increase oxytocin and serotonin levels dramatically and also promote neuroplasticity, has been suggested. However, using these substances in children raises ethical concerns due to their psychedelic properties and potential side effects. There's an emphasis on the necessity of identifying the specific subset of individuals who respond positively to oxytocin treatment by factoring in variables such as age, social phenotypes, and pre-treatment oxytocin levels. An interesting consideration presented is the idea of developing a biomarker panel that allows experts to identify children at reasonable risk of developing autism to expedite diagnoses and interventions. A noteworthy part of the discussion relates to the current challenges of diagnosing autism, particularly in resource-limited settings or in socially disadvantaged communities. At present, autism diagnoses typically involve extensive clinical interviews, which are often not scalable due to practical constraints, including access to medical experts who are qualified in the diagnosis of autism. A conversation then transitions to discuss the potential role of vasopressin, hormone chemically similar to oxytocin in influencing social behavior, and as a potential therapeutic agent in the treatment of autism. Notably, earlier studies have shown that vasopressin was critical for male social behavior, inducing pair bonding with a female mate and stimulating paternal care, providing further impetus to explore the potential therapeutic applications of oxytocin and vasopressin in autism treatment. Inspired by these findings, further investigation into the development of safe, scalable, and effective treatments for autism that facilitate rewiring of brain circuits and tap into neuroplasticity is suggested, while at the same time ensuring ethical considerations, particularly concerning pediatric populations. The conversation delves deeper into the potential of vasopressin and oxytocin in altering social behavior, examining their potential roles in the diagnosis and treatment of specific disorders like autism. Vasopressin, despite being chemically similar to oxytocin, was found to have a significant impact on male social behavior in prairie voles. A fascinating study carried out by Dr. Karen Parker in grad school showed that injecting vasopressin into prairie voles induced clear instances of pair bonding and heightened paternal care. Conversely, injecting a placebo had no effect, underscoring the incredible potential of these hormones and their ability to play a role in behavioral changes. This discovery opened further intriguing possibilities about how the brain functions, championing the perspective that certain abilities or behaviors might lay dormant in our brain circuitry, awaiting the right trigger to be unlocked. But furthermore, it conveys the opportunity that brain peptides can function as switches that control these potential behaviors. Later on in her career, Dr. Parker started focusing more on human behavior. Noticing that social interaction impairments were a core feature of autism, she began exploring the role oxytocin could play in this condition. Complex clinical trials soon revealed that while blood oxytocin was not a differentiator between individuals with or without autism, it did influence the levels of social difficulties experienced by individuals irrespective of their autism status. Consequently, social deficits in the general population might also be related to oxytocin levels, extending the peptide's potential impact beyond autism. These findings spurred further questions regarding the roles of oxytocin and vasopressin in human sociality. As the research continued, it became more apparent that despite the hype around oxytocin, vasopressin could very well play a more critical role in autism and social functioning. A particularly intriguing question pertains to whether vasopressin levels can accurately predict or indicate the onset of autism, offering the potential for early interventions. The podcast begins to further investigate the possibility of vasopressin as a social biomarker in both monkeys and humans. It's highlighted that complex social behaviors occur in more advanced species like humans and monkeys, making them ideal candidates for studying social cognition. As the discussion first delves into the development of a primate model for autism, identifying animals within the large monkey colonies showcasing autistic-like traits, Dr. Karen Parker and her team are able to establish a model that echoes core features of autism. The significance of this model proves instrumental in the biomarker discovery phase of their research. Taking samples of neurotransmitters from the monkeys, they observed a correlation between the level of vasopressin in cerebral spinal fluid and social behavior. Higher levels coincided with more socially active monkeys. Interestingly, this correlation was not detected in the monkeys' blood samples. Upon further inquiry, the correlation between vasopressin and social behavior was consistently observed over time in individual monkeys, affirming vasopressin's potential as a biomarker. Particularly, the monkeys with the lowest level of vasopressin spent the least time grooming. Key social bonding activity in primate species. This finding offers crucial insights into the role of vasopressin and introduces a new perspective on understanding social behavior. The hosts also discussed the parallelism in social behavior between primates and humans, providing validation for this approach. They emphasized that sophisticated social cognition is not confined to humans, making complex social cognition an attainable target for study in non-human primate models. Through observational studies, naturally low social monkeys are identified, offering a unique opportunity to study these autistic-like traits in a non-invasive ethical manner. This detection, interestingly, aligns with the ongoing discussion on the prevalence and relevance of vasopressin in primate social behavior. The hosts also stressed the need for careful justification of any animal experimentation with an inclination for non-invasive observational studies whenever possible. They also recognize the potential of stem cell and organoid work, which could propel disease progress understanding without the need for whole animal models. This exploration into vasopressin's potential role in social behavior gives rise to further questions, including the hormone's influence on human behavior and its consequences for disorders influencing social interaction. Dr. Karen Parker and Dr. Andrew Huberman engage in a stimulating discussion exploring vasopressin's potential role in understanding autism. They note that autism doesn't exist in monkeys, but they can exhibit autistic-like traits. To understand if vasopressin plays a role in autism, they utilize cerebral spinal fluids from monkeys and humans, discovering intriguing correlations. Monkeys considered low social had less vasopressin in their CSF and spent less time grooming social bonding activity in primates. However, no differences were detected in their blood vasopressin level. Parker brings the attention to the evidence of behavioral therapies being more effective the younger the child is. Her underlying hypothesis is that autism susceptibility genes may interact and converge upon a few common pathways in the brain, positing vasopressin to be one such pathway. This realization led to the exploration of pre-symptomatic infant samples taken before symptoms of autism manifested. These samples, referred to as liquid gold, were from infants taken prior to any opportunity for considerable social interaction. It was discovered that infants who later received an autism diagnosis had lower vasopressin levels as infants, substantiating the hypothesis of early intervention and potential vasopressin replacement therapy. This breakthrough indication suggests vasopressin as a conceivable biomarker. In their pursuit of understanding the role of vasopressin, Dr. Parker highlights the need for more sophisticated studies to ascertain if the lower vasopressin level roots from production deficiency. She mentions their funded research to look into post-mortem human brain tissue for insights into vasopressin gene expression and cell production. The outcome of these studies could shed significant light on whether vasopressin can be the missing piece in early autism diagnoses and even treatments. Dr. Huberman also brings up the question of excessive urination in kids with autism, as vasopressin also functions as an antidiuretic hormone. This query reiterates the complexity of vasopressin's involvement in various physical NCOX. The conversation continues to explore this nuanced research avenue, promising profound insights in future studies. In this part of Huberman Lab podcast, Dr. Andrew Huberman and Dr. Karenparker delve deeper into the potential therapeutic advantages of vasopressin for children with autism. They touch on the concept of central diabetes insipidus, a disorder linked with deficient vasopressin characterized by excessive thirst and frequent urination. These symptoms could potentially overlap with autism signs, leading to possible confusion and misdiagnosis. Dr. Parker emphasizes this theory in a perspective piece she authored highlighting the perplexing data of kids with autism exhibiting high water consumption and regular bedwetting. This could potentially suggest an overlooked link between autism and unusually low vasopressin levels, prompting the hypothesis that vasopressin supplementation might benefit certain subsets of kids with autism. An upcoming study is being planned to further assess this possibility. Dr. Parker brings attention to the potential influences of vasopressin on social behavior and raises concerns about the severe adverse effects associated with improper dosing. She elaborates on one of her trials where children as 6-12 with autism were administered vasopressin through a nasal spray twice daily for 4 weeks. The outcome demonstrated beyond expectation, indicating increased social abilities based on parent reports, clinician evaluation, and child performance on laboratory-based tests. Interestingly, these improvements were identified not only in social behavior, but also in reduction of anxiety and repetitive behaviors. This compelling evidence on vasopressin treatment's potential prompts further explorations concerning its timing and dosage to maximize effectiveness while minimizing any adverse effects. Simultaneously, it underlines the importance of context and individual characteristics in guiding scientists' approach to biological matters, pointing out the diverse reactions to vasopressin found among typical and non-typical individuals. However, even with the seemingly positive results, echoing the theme of careful exploration, Dr. Parker calls for judicious replication of these findings. She believes this would reinforce the treatment's credibility, addressing the lingering question if the reported benefits from the first trial were mere luck revolving around the right participants, or if it signifies a broader applicability of the vasopressin treatment to the autistic population. Towards the end, Dr. Huberman reciprocated his experiences with fellow psychiatrists, providing examples of self-experimentation to understand the side effects of their prescribed drugs better. This moment of shared insight adds a new dimension, linking the personal interaction with the broader spectrum of effects and side effects vasopressin might pose, even if anecdotal. As the session progresses, the intertwined discussions and findings keep the listeners' curiosity piqued, fueling their urged to learn more. Dr. Huberman and Dr. Parker further their discussion on the potential roles of vasopressin. They speculate about the mechanism through which vasopressin might be affecting social behavior and cognition. And the questions raised range from whether vasopressin increases social motivation or if it directs attention to social cues where there would typically be less focus. Dr. Parker points to imaging studies as a possible means to understand how vasopressin is acting in the brain. She envisions a future where functional brain imaging could reveal where vasopressin is binding and what kind of circuits are involved, allowing researchers to identify their targets with precision. This conversation veers toward the microbiome as Dr. Huberman references studies on fecal transplants that resulted in some degree of social deficit rescue in the host. He raises the possibility that administration of vasopressin might be rectifying a deficiency in the gut, thereby affecting behavior. Dr. Parker brings up a fascinating mouse study where probiotics normalized social functioning in mice displaying low blood oxytocin levels. This improved functioning was linked to upregulated gene expression of oxytocin and vasopressin in the hypothalamus, an effect that was mediated through the vagus nerve, which has direct projections to areas of the hypothalamus that produce oxytocin and vasopressin. This leads to an intriguing discussion on how increasing the diversity of the gut microbiota, as probiotics do, could potentially result in the upregulation of oxytocin and vasopressin gene expression in the brain. The possibility of this being a brain mechanism doesn't exclude the potential role that changes in the gut could play. Dr. Parker also points out an interesting potential study involving a vagus nerve stimulator. She hypothesizes that using a vagus nerve stimulator on people with autism could possibly change social behavior and increase oxytocin and vasopressin levels. However, she mentions that due to funding issues, this study is yet to take place. Pharmaceutical company Roche's trial on their compound bapineuzumab, vasopressin VNA receptor antagonist, is mentioned towards the conclusion, implying it as the complete opposite of Dr. Parker's approach and awaiting more details in the continuation of their discussion. In the continued conversation, Dr. Huberman and Dr. Parker dive deep into the mechanism of vasopressin's functioning in the brain, specifically focusing on the VNA receptor, which is implicated in social behavior. They discuss how certain animal studies suggest vasopressin can lead to aggression, but also indicate that it's strongly tied to the social context. The topic shifts to pharmaceutical company Roche's approach, which contrasted Dr. Parker's by utilizing an antagonist to the main vasopressin receptor in the brain. The reasons behind Roche's choice remain unclear to Dr. Parker, leading to speculation that the antagonist could potentially increase the bioavailability of oxytocin, though she likened this hypothesis to gymnastics. Following segment addresses the controversial issue of the correlation between vaccines and autism. They disentangle a background of a fraudulent study that suggested vaccines cause autism, indicating this was led by Dr. Andrew Wakefield, who lost his medical license due to evidence of falsified data. Though his study stirred fear and spent a substantial amount of funding worldwide, it was debunked by multiple subsequent investigations showing no link between vaccines and autism. They note that out of this controversy emerged an unfortunate side effect: the hesitation amongst some researchers to delve into studying the connection between immunology and autism. As Dr. Huberman and Dr. Parker wrap up, they reiterate the importance of understanding the biological mechanisms that underlie autism and other social function deficits. Dr. Parker's pursuit of groundbreaking treatment through the administration of vasopressin reflects the need for such cutting-edge, albeit risky, studies to advance our understanding and improve treatments for autism. Dr. Huberman and Dr. Parker discussed vasopressin's role in the brain with a particular focus on the VNA receptor and its impact on social behavior. Our conversation expanded on the different findings from animal studies suggesting that vasopressin can lead to aggression, but also highlighting that this hormone is strongly tied to the social context, which means effects can vary. An interesting divergence was noted in the approach taken by pharmaceutical company Roche. They used an antagonist to the main vasopressin receptor in the brain, a move that sharply contrasted with the strategies employed by Dr. Parker. The motivations driving Roche's decision remained nebulous to Dr. Parker, spurring her to speculate that the antagonist could probably enhance the bioavailability of oxytocin, although she characterizes this hypothesis as akin to performance, an acutely controversial subject. The supposed link between vaccines and autism was navigated. They shed light on the origins of this contentious belief, explaining its roots in a fraudulent study conducted by Dr. Lakefield, who later lost his medical license due to the revelation of falsified data. Wakefield's discredited study caused widespread fear and diverted substantial funding globally. Fortunately, his inept and deceitful research has been refuted categorically by subsequent investigations, which found no correlation between vaccines and autism. That said, the far-reaching repercussions of this controversy include reluctance among some scientists to explore potential connections between immunology and autism, underscoring the dialogue. Both guests reiterated the significance of comprehending the biological mechanisms involved in autism and other social function deficits. Dr. Parker's pursuit innovative treatments through vasopressin administration brings into focus the need for ambitious but potentially risky scientific exploration in order to propel our understanding forward and enhance available treatments for autism. With these conversations, the Huberman Lab podcast continues to elucidate complex scientific subjects, dispel misconceptions, and shed light on the hard work that occurs behind the scenes in scientific research.